and it turns out that we have a checkup waiting for us. Poly patient. I set this one up. I started this encounter this morning before I started seeing patients. So it looks like this poor Polly has been waiting 249 minutes. But of course, that wouldn't hopefully happen in my practice. And here's Teresa's. I didn't even point out this number, but that offer to schedule well visit, we did that 12 minutes ago. So people can easily keep track of how many minutes people have been waiting. In this case, let's just pretend that she hasn't been waiting that long. So I already did the nurse part of this visit, including taking the vital signs and doing a developmental screen and things like that. And when the nurse finished up her job and clicked through her screens, this pink bar showed up for her because it turns out that at 6 months, we always do a hemoglobin. And you guys may or may not do that at 6 months. All of this is user configurable. But we have in the checkups, what we call the work plan, we have it to automatically have the nurse do a hemoglobin. So they would see this pink bar, and they would click on it, and they would put the result in. Let's say Polly's got a hemoglobin of 12. Done. And now their little pink bar has gone away. And taking care of that pink bar could take place before I saw the patient or after I saw the patient. It's kind of independent of what I have to do. That's keeping everybody optimized, keeping everybody busy. If any nurse had a free moment, she could have gone in to take care of Polly's hemoglobin. It didn't even have to be the same nurse who brought her back, actually. Okay, now it's my turn. I'm going to do my well preview. And this was some information I typed in this morning, but pretending to be a nurse. Here for a well check, has a rash on the face, sleeping problems, and then you've got some vitals and things here. Now I'm going to see the chart view, and here's little, what is her name? Polly up here. We can see that she was seen for an ear infection a few days ago and prescribed Ceftonir or Omnicef. That also appears in this med box for sort of a quick glance at that. This patient is also allergic to amoxicillin. Oh, there's our hemoglobin. I mentioned that. That's the result the nurse just put in a moment ago. That's your 12 if you want to see that. Let's take a look at Polly's. I don't remember if she has an appropriate vaccine record or not. Oh, she does. Good. Okay, this turned out to be a good example. So someone has gone through and put in, even though this is a test patient, put in the typical vaccines that she would have gotten at birth and at 2 months and at 4 months. This detail page is not a page that most of us ever even need to look at. Usually, you just look at this page here, right under the Vac tab, and what it shows you is the things in green are the things that she's due for today. And the order of this is configurable. We deliberately set this up. The reason we put DTP polio and Hep B kind of clustered together here is because we use the combo Pediarix. So this is easy on the eye. You can see she needs her Pediarix and her Prevnar and her rotavirus. And there's very robust logic behind the system to make sure that it prompts you for the correct vaccines at the correct visits. Even if you have some families transferring in who had, got vaccines in a different order, or you have the occasional mom, dads want to space these things out or do whatever crazy stuff, this will keep track of it for you to help keep people giving the right vaccines at the right time. Let's go back to that first chart view. We were looking at that. We also, at the start of the visit, I'd like to look at this tab. This Dev tab here shows you the growth charts. I will admit that it looks like the height and weight I put in here were a little bit strange for poor Polly. Sorry about this, Polly. But I made you lose an inch of height since your last visit, which gives you a funny-looking percentile. From this view, you can see everything just lined up, the percentiles and the exact amounts. Or from this tab here, you can see her CDC growth charts. Her weight looks good. Poor Polly, I made her shrink there. That was just poor data selection by me. And you can also see her head circumference. Oh, I didn't get that one right either. That's what you get from making up data early in the morning. Anyway, we can look at that and talk to Mom about it. Now we're going to start the meat of our well check, and this is very configurable. Remember, last time we did the sick. This time we're going to do the well. And the screens that pop up for both the sick and the well, you can configure with the help of Xcite, or you can configure it yourself. We like to start with that past history screen here. Then when you're done reviewing that, we like to have our staff take a diet and sleep history. So you can skim through this. This is a nursing baby who wakes frequently at night. Okay. We do a brief developmental screen first, which is just a couple of questions at some of these key ages. Here at this age, we actually only ask 2 questions about sitting and rolling. But then we also do a formal developmental screen. this is using the PEDS. I don't know, some of you listening to this, watching this might also use this. This is the PEDS instrument, which as a developmental screen, and you can go through these and record the information that the parents put on that PEDS developmental screening form. Rather than click one by one, you can click the Set All button, and then we have some text like this one, no predictive developmental concerns, and OK. And then we're done. That was our PEDS form. Now we can do the same ROS HPI. You saw this screen before, but you could type here, for instance, some more details about, what was it? Rash on the face, rash seems itchy. You could say, has, I don't know, has tried cream, something. You could put as much HPI here as you want, and again, you can either freehand type it, or you can use these prompts here, and you can add your own prompts over there. It's really very, very easy to do this, just on the fly, really quick. Let's say we want to add rash. Let's say you want rash as a prompt, a word that you like to use. Type it, click Add to List, and that's it. It's there. And you could use this. This time we could say it's had a rash for 6 months. Bam, just like that. That's how quick it is to set this up. And you can set up these lists like this. See, it says personal here. It can just be your personal. Every nurse and every doctor has their own set, or they can be shared by the practice. That's called a common list, and you could set those up if you wish. Anyway, so very, very quick either to type or to enter these things in without typing. Oh, I just erased it. Okay, let's just say, what did I say? How long do they have the rash? I forget what I said. I've had rash for 2 weeks. Okay, good enough. All right, now we get to our physical examination. And we've set up before you had seen sort of the sick exam for the pharyngitis that populated this. This time we have a more substantial exam we call PE female. For a physical exam, covers every organ system. And by the way, the ePro knows if this is a male or a female, so if this were a male, this would have said male. It doesn't offer to do a female exam on a male, obviously, because it looks a little different. And if you want to apply this exam here, this is an all-normal, thorough physical exam on a female. Click, and there it pops up. And the exact things here you change by your practice. If, for instance, in your practice you, I don't know, never do neck exams, you could leave this out and not have it part of your stock exam. It's very, very quick to change either the stock exams or even, I'm going to clear this just for a moment, even a stock exam for just one body part. So you want a normal heart exam, you can click there and up it pops. And if you want a normal respiratory, and all of this you can configure very quickly on the fly. I can show you guys how to do that if you want later. Okay, we're done with our physical exam. The anticipatory guidance prompts come up next, and we can say that yes, we talked about feeding, yes, we talked about sleep, yes, we talked about vehicle safety. All of this, of course, very user configurable. You can add a text here, click there, and add a comment to any of this if you wanted to. Done. Chart alerts pop up here, and this would be things to alert you about very specific circumstances like, I don't know, something unusual. Oh, okay, let's say at this point, if Dad insists that vaccines only be given one at a time or something, and you wanted to keep that in mind, you could use that as a chart alert, as just an example, and type that in, and it would pop up at this point so that the providers would see it. This patient doesn't have any alerts. Most patients don't have any alerts. And then you get your treatment list for this 6-month well visit, and these are different at every well visit. 6 months, of course, is different from 9 months and 12 months, etc. This is all very, very configurable, sort of in a similar way I showed you adding things to that text screen. You can add or take things off of these screens as well. You can have a version of this treatment list just for you. That would be a personal list, or you could make it a common list for the whole practice. This is common list and personal list. What we've done especially is we put our usual vaccinations here, 6-month immunizations right here, so we can click them all. Bammo. You can also order a flu vaccine if it's the right time of year. We don't have those in yet, obviously. And then you can click follow up in 3 months. And that's it. You ordered your vaccines, you ordered your follow up. You could order any of these other little comments that you may have done. What else should I show you here? Oh, we see some children who get their vaccines through the VFC program. So those could be ordered through here. Okay. And then we're done with our well child. Okay. And this is, again, user configurable, but we have our work plans automatically order up essentially a V code for nutritional counseling. This satisfies some of our insurance company requirements that we're going to build this V code up there. And you can add some comments under that if you want to, although we usually don't. And we're done. We're finished with the well check. You can look at the billing now if you want to. Normally you wouldn't because this is very reliably correct. But for instance, we've got the hemoglobin screen. We did the developmental screen. We did a finger stick. Here's all our vaccines we're giving. Oh, and here's our vaccine first component and another first component vaccine. We should have our, here's our additional over here. And all of this is done automatically. These vaccine admin codes are generated automatically, and they're actually a pretty significant source of income, so you want your EMR to do that automatically. You guys shouldn't have to be picking those things out. Okay, that's that. I think she had, she also had this rash on her face. We kind of ignored that, but just for the sake of adding this in, let's say that we also diagnosed eczema. So that of course should have appeared on our physical exam, but I forgot to do that, honestly. It's on our short list of sick assessments here, but if it wasn't, and I started to type this a moment ago, you could search for your favorite assessment, but here it is, eczema. And here are some of our favorite things we do for eczema. This business down here, for those of you not from Georgia, we see a lot of patients who get their health insurance through the Medicaid WellCare program, so we set up these preferred categories so we're sure to prescribe basically the correct steroids for eczema or for other conditions that are actually covered by WellCare. But that's why it might look a little odd to you, but that's why we set it up, and it's a huge money saver, huge time saver, because we don't have to keep looking this stuff up. So if you want a class 3 steroid, one of those two, either of those two will be covered by WellCare. We set all that up. Let's say we're going to do a dermatology referral, and we're going to put this kid on Acclimate. And we also talked about minimizing the length and frequency of baths. Okay, done. This double checks our dosing on that Acclimate medication. We might put in duration PRN rash there just to flesh that out. And here we go. So I'm pretty confident that we're done. But the neat thing is that although we're done and I'm ready to leave the room, there's still a lot of other things that have to take place, but I really don't have to worry about them. I'm going to click exit. I'm going to click I'm finished. And you might look at that and go, wow, look at all that stuff. But it's all important stuff that has to get done. So let's go through these. Again, this Acclimate manual print, ordinarily there would just be a little white box here to send it via SureScripts, but I guess that's not configured for this test patient. Give out sheet dermatology referral. You may remember I ordered dermatology referral, so the people in green up at the front, they know to give out that sheet, so they will click it. And I'm not an admin front desk, so it's asking me if I want to take over. Ordinarily, you wouldn't get that. And then the nursing staff has to enter in the vaccine information, like that rotavirus. She'll put in the lot number and other things here. There'll be a literature date. That's the date of the VIS thing. She'll type. And, well, anyway. A lot of this will be pre-populated, honestly. Yeah, normally the lot number just pops up here, but it isn't in this case because it's a test patient. You know what? I'm not going to type in a weird lot number because I'm afraid that later today real patients will get that lot number, and I don't want to confuse anyone. So I'll just hit I'll be back and leave it for the roll. So, but all of these bars are sort of picked off one by one. The nurse will click this, enter the lot number, click this, enter the lot number. This grits has to do with this. It's a Georgia thing for us to send the information to the registry, and then the nurse will click here, capture a signature. There's the vaccine information acknowledgement, understand the risks and benefits, and sign. And I'm working from my desk, so I don't have a capture device. This may look really weird, but I'm just using my mouse. But in the exam rooms, we have a capture device, and that's gone. And we also have our front desk people ask if they've made their next well and check appointment, and take care of everything else they need to do. And I'm done. No light blue here, so I know I can move on to the next room. Click, and that's it. And that's a well check. What would be helpful? How much? I don't know how much more time you want me to demonstrate things, or there are other features you think would be good for me to show now, or questions from anybody?
I think it's great, Dr. Benark. I mean, I see that maybe you could just talk about how these pink and green things work. for your office staff when there's, 5 patients in the office or something? Do they see?
I think that I'm tempted to show you. It's kind of a HIPAA violation. I guess I shouldn't. To show you my real office, what you would see is many of the rooms have patients in them, and then they have these bars saying what needs to happen. When Teresa patient goes up to the front desk person will finish these things, and then she's gone. She'll offer to schedule this, and then what we say in the lingo is they pick off the bars. And once the bars are done, the patient's gone. Everything that's done has been done. The bars are pink tells the nurse to do something, green tells the front office staff to do something, and then the doctors have a bar in a different color. Just as an example, if let's say I wanted one of my partners to poke their head in there and look at this rash. Well, you know what? I want another part. I'm just giving you a crazy example here. I could make a bar for Dr. Marianne here. Please look at rash. Okay? And I put that in there, and there it is. So Marianne knows that this lovely maroon color is hers. So as she's in between patients and scanning the telephone room and the pods, she'll say, oh, that's my color. And then she knows that there's something I want her to do. And she can go there, and then she can touch that bar and finish it up. So these colored bars are honestly nothing short of magical in that they keep everyone, the doctors and the front office staff and the nurses, if you had a respiratory therapist, if you had a pharmacist, if you had a radiology tech, there might be all sorts of people, depending on the setup of your office, who have things to do, and you have to tell them to do things. But doing if you think about email, you have to get out your phone, you have to look for your email, you have to touch the message. It's not just that they're told to do something. They're told very explicitly, just at a glance, okay, I need to, for instance, here's my mouse, I need to give this vaccine. So I can go over to the refrigerator, I can pull out a dose of that, and then I can click on this and put in, oh, see, this one was populated by the lot number, and the literature date should pop up right here. And then you hit immunization given. Without giving, okay, I do have to put a date in here. I'm kind of messing with this a little bit, but normally the date pops up in a real patient, and you hit that, and now it's gone. And if you notice, the bar that used to be there is not there anymore because the thing was done. So the bars are created when things need to get done, either explicitly or by the work plan. For instance, reminding the nurse that a 6-month-old needs a UA, or a 6-month-old, needs a finger stick, or a 5-year-old needs a urinalysis. Those are put up there by your work plan, which kind of guides the nurses, so anybody else tells them what they need to do.
That's great. So I guess any nurse can look at any patient and say, I'll jump in.
Exactly. Now you're getting the magic of this, right? I don't have to go tell my nurse. In fact, I don't have to go tell any nurse. We typically, we have 2 offices. This one typically has 3 doctors and about 7 nurses working, and they can all help each other out. If, for instance, one doc is sort of getting backed up, the other nurses can kind of chip in and get their responsibilities done. The telephone room, too, we usually have at least one nurse whose main responsibility is telephone calls. But if you can see that this phone room is getting busy, any nurse can just pop right in the telephone room, pick off a call, and you could tell at a glance that this one, 45, has been waiting longer than this one, 19. So then you could say, oh, I'm going to do this first one. But we also put a little bit of text in here to tell each other what it is. So if this said, mom at airport needs call right away, then you would know to call that one first. And you don't actually have to click it to know that. I mean, the text, it tells you at a glance what needs to happen. You don't have to click to figure out what you're supposed to be doing.
So I'm not seeing you do a lot of typing. Is that pretty standard, that you don't have to do a lot of typing?
Yeah, some of my partners, now as it turns out, I do type. I actually type very well, but I can get through entire encounters without typing a word, and I have some of my docs are not particularly gifted typists, so they rely more on the pre-configured lists, the lists of words that you can just touch word, and put together your text. Now, since I don't actually use that much, my lists that you saw weren't very robust. They weren't very long. I think some of my other docs have done a better job creating lists that work for them. But I don't use that a lot myself, honestly.
And so is that something that Xcite Health sits down and does with you in advance, or?
You you can sit down and think through the kinds of phrases that you want to put there. But in a way, it's almost easier to do it as you're seeing the patients because that's when you're thinking about what do I usually ask? And it really is quick just on the fly to add those words, add. So in truth, I think I'm not sure, just thinking about this, for me, I think I do most of that adding just when I'm in the exam rooms. Like if I'm with Tamara here, and what was her? I'm trying to remember what did we do to this poor girl? Oh, this was, you know what? This was a telephone call, but that's an encounter as well. And we mentioned this exposure to communicable disease, and when I went in there, I realized that these are the common treatments. There were none because I just haven't bothered to configure this, but this is how long it takes to do it. Let's say that we often, for this diagnosis, prescribe Cipro, okay? So here's my prescription for Cipro, and let's just assume it's an adult, and we're going to use this for prophylaxis. So what I do is I click on this icon there, update the list, done. And now, forever, if you get this diagnosis, exposure to communicable disease, Cipro is going to be suggested as a treatment. It's part of it. I've just added it to the common list, and it's there. It's done. And that's how long it takes to add things to these lists. Very, very quick.
So it's really built upon how you practice medicine, whereas another doctor could have a different drug that they always recommend for the same.
Right. And you would decide as a practice. Now, what I happen to add this under the common list. This is the list that me and all of my partners will see. But you can also generate, just to the left, see this tab here, personal list. If for whatever reason you're the maverick doc in the practice and you like to, when there's exposure to a communicable disease, the first thing you're going to do, I'm just being silly here, but you're going to give a Gardasil vaccine. Let's just say, okay? Click there, add it to the list, and now Gardasil vaccine actually sticks to the personal list of this diagnosis. If I make this diagnosis again, this will be sitting there waiting for me, and all I have to do next time, it'll look just like this, and I click it, boop, there I've ordered it. It's done.
Okay, so you've got some questions that have come in, so I'm going to run through a few of them and then turn it over to Barry. So do you finish charting the encounter while you're in the room with the patient, or do you do it after the patient or parent has left? Like I know a lot of doctors have offices, and they kind of go there in between patients and fill out their paperwork.
Yeah, I don't like to do that. I really do prefer to do it in the room. I think the charting is more accurate, and I think that as a habit, I like to say out loud what I'm doing as I'm doing it, right? So I'll say, okay, so what I want you to do is da-da-da-da-da, take shorter baths, don't soak in soapy water where we're talking about eczema. Or I'll say, and now I'm going to order a Gardasil vaccine for you. And as I say it, I click it. And that way I don't make errors, and the nurses and the patients aren't surprised. I say, I say it as I do it. It's all in the chart. It's all clean. And the charting is so fast. I think it would honestly take me longer to walk to my office and sit in front of the computer than it would to just, click, 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 click. I'm done.
Okay. In the same sort of vein, many providers, patients, and parents there's another question, have complained that while the provider is charting, either nurse, physician, or whomever, in the electronic health record, it kind of takes away from the interaction. Do you feel you still have good eye contact interaction while using Xcite Health EHR?
I think that is a new challenge for all of us, for doctors and nurses, in that depending on when you went to medical school, you were used to having a different style of interaction. What I try to do is briefly look at the computer to get an idea of what the problem list is, what's on my mind, and then really walk away from the computer, focus on the patient, do my physical exam, talk about the history, and then I can go back and enter the information. So I definitely like to keep the patient engaged. When I mentioned before that I talk out loud about the plan, that's only when I get to the plan part, to the screen you're looking at now. When I go through a screen like this and I say, okay, I'm going to, this isn't the most useful screen. Let's do something. Let me show you a different one, a more ordinary. Let's say we're going to do a croup. Okay, so let's say, your child has croup, so I want you to. It should get better within a few days. So croup course discuss with parents, and I'm going to prescribe dexamethasone. And I do that standing in front of the computer. Click, click. But that's a very small part of the encounter. It just takes just a moment to do what I just did. And now I'm done. Oh,
Okay.
okay. Well, this patient, okay, Norna, you don't see the screen because this was a telephone encounter, so we didn't know her weight, so it doesn't know how to dose the dexamethasone. I'm just going to cancel out of this. But ordinarily, you wouldn't have seen that screen. But ordinarily, we probably wouldn't have prescribed dexamethasone over the phone for croup either. Okay.
Right. So when you're hiring a new provider, physician or nurse or any other clinical staff, how long does it usually take that person to get used to charting in the Xcite Health electronic health record?
The system is very, very fast to learn. For nursing staff and for receptionists, I literally don't do any formal training. They pick it up while shadowing some of my other staff for a day or two for the first couple of days of their employment. They're shown what they need to do, and they pick it up, and they're done. That's it. For new physicians and new nurse practitioners, we do formal training. And for the last several I've hired, I do two-hour sessions, 2 hours, and then they can continue to practice with it either from home or from the office. Then I do a second 2-hour session to go over things with them again, reinforce some things, and I found that that is plenty of training. The last doc we hired, which was only a few months ago, I think within 3 weeks, she was seeing an absolutely full slate as quickly as seeing patients as she was at the practice that she had previously been with.
Great, great. I've heard some people talk about this system or other systems in regards to a term called workflow, and I would imagine that most people say, well, what the heck is workflow? But, having seen this demo today, I kind of understand it a whole lot better. So can you maybe describe what you call workflow or what you call the beauty of this system?
You hear workflow. I admit that as a doctor, part of my brain thinks that's just kind of like a marketing buzzword. It's just one of these words that is associated with electronic records. But it really does have a meaning. And I guess what it comes down to is can a health record like this actually help? Are you doing it just because you kind of have to, and you have to meet meaningful use, and you're sort of being forced into doing it? I think some people are in that boat. But more important to me, an EHR that actually helps with workflow, it's more than just making a chart. It's actually helping you run an efficient business that provides good medical care. It keeps your patients happy. They don't have to wait. It keeps your nurses happy because they can stay efficient and work. They don't want to sit around wondering what to do either. They don't want you yelling at them across the hallway. That's a HIPAA violation too. Get in there and give a vaccine. You don't want to have to do that. The beauty of the workflow is both in situations that are automatic and in communicating instructions to the rest of the staff. So automatic work plans or automatic workflow are things like, let me think of an example I haven't shared. Okay, here's an example. I could click on this. I'm just going to describe this to you for the sake of time. But for instance, we decided, this is going to be a workflow thing, that when we order a laboratory, we want someone from our staff to check to make sure that the patient really went to the lab and got it done. And the way we did that was we made an automatic workflow that when a lab is ordered, it makes a little task, like one of these bars, a little task for one of our employees so they can go through these tasks and make sure that they were connected to a laboratory result. When laboratory results come in, that little task goes away. So if the laboratory result doesn't come in, the task is still sitting there, and 2 weeks later, we can generate a phone call or a letter or whatever's appropriate for that circumstance. So that's a workflow in that this takes place kind of behind the scenes. I don't have to remember that this patient had a lab. Oh, did they go get their labs? I don't even have to think about that because I know that the workflow is going to force the logic of the machine is going to make sure that it was done. And then, of course, there's workflow that's generated as part of these well encounters. So patients at a certain age need a developmental screen. Or let's see, if I'm seeing a patient with asthma and I want my nurse to come in and do asthma education, this is a very simple workflow, but the workflow is just a pink bar to that staff member to go do asthma education. or for instance, I could attach a workflow to a new prescription for an albuterol MDI. So next time, whenever I prescribe an albuterol puffer, I also want a workflow to fire off a pink bar to tell a nurse to teach the patient how to use it. Let's say I wanted to do that. That would be very, very easy to do. I could attach that little bit of workflow to all new albuterol prescriptions. Very simple.